Hello and welcome to Dr. Ruby's Prostate Cancer Wellness. Have you ever heard of a condition that impacts millions of men worldwide, yet sneaks up so quietly, it barely gives a warning? Have you ever stopped to wonder if your body might be sending you subtle signals that you haven't quite noticed yet? Now here's the big question. If there was a way to catch this disease early, wouldn't you want to know how? Well, don't look away from this video. Today, we're diving into 9 dangerous symptoms that could be red flags for prostate cancer, a condition that's far more common than most people realize, yet doesn't always get the attention it deserves. And here's the kicker. Symptom number 8? It's a critical warning sign that most men overlook completely. So if you care about your health, or the health of someone you love, stick with us until the end to make sure you're armed with all the vital info you need. Oh, and one more thing. Hit that subscribe button right now to stay in the loop with the best health tips tailored just for men. Because a small choice today could save you, or someone close to you, from serious trouble down the road. Let's get started. Before we jump into those warning signs, let's take a quick moment to talk about the prostate, a small but mighty part of every man's body. Tucked right below the bladder and wrapped around the urethra, this little gland has a big job. It produces seminal fluid, which nourishes and protects sperm, and it even helps regulate urine flow. Most of the time, it quietly does its thing without drawing much attention. But when something goes wrong, whether it's inflammation, enlargement, or cancer, it can throw the entire urinary and reproductive system into chaos. So, how does prostate cancer sneak in? It starts when cells in the prostate begin to mutate and grow out of control, sometimes forming a tumor. In the early stages, it's a silent troublemaker, showing no obvious signs, which is why so many men brush it off and miss the chance for early detection. Here's where it gets serious. If left unchecked, that tumor can grow fast and spread to other parts of the body. Think bones, lungs, even the liver. And by that point, treatment becomes a whole lot tougher. But here's the good news. Did you know that if prostate cancer is caught early, the 5-year survival rate can be as high as 99%? That's incredibly encouraging. The flip side, too many men don't catch it until it's advanced. And at that stage, the odds of successful treatment drop significantly. Once the cancer spreads to other organs, not only does treatment get more complicated, but it can also take a serious toll on your overall health. So, how do you protect yourself? The answer is simple: regular checkups. Even if you're not noticing any obvious symptoms, medical tests can spot the tiniest abnormalities in your prostate early on, giving you the chance to act fast. Here's the key takeaway. Early detection equals a higher chance of a cure. Don't wait for major symptoms to show up. By then, it might be too late to turn things around. That's exactly why knowing the early warning signs is so critical. And coming up next, we're going to walk through 9 dangerous symptoms of prostate cancer that no man should ignore. Let's dive in. Now let's get to the heart of it. The 9 early warning signs of prostate cancer. If you or someone you care about notices any of these symptoms, don't brush them off. They could be your body's way of waving an important red flag. Symptom number 1. Trouble urinating, weak flow, or stops and starts. Have you noticed it's taking longer to get things going in the bathroom? Maybe you're straining more than usual, or your urine stream feels weak, like it's trickling out or stopping mid-flow. Sound familiar? If so, pay close attention. This could mean a tumor is growing and pressing on the urethra, blocking the normal flow of urine. At first, it might just feel like a minor annoyance, but over time, it can get worse, making you uncomfortable and disrupting your daily routine. A lot of guys chalk this up to just getting older, or assume it's benign prostate enlargement. But if it sticks around or keeps getting worse, don't wait. Get it checked out to rule out prostate cancer. Symptom number 2. Waking up to pee multiple times at night. Are you finding yourself stumbling to the bathroom in the middle of the night more often than you'd like? Once or twice might not raise an eyebrow. But if it's happening over and over again, night after night, it could be a sign something's up with your prostate. When the prostate enlarges or a tumor forms, it can put pressure on your bladder, making you feel the urge to go even when it's not full. Now don't just shrug this off as part of aging. So many men think frequent nighttime trips to the bathroom are no big deal. But here's the truth. This can be one of the earliest clues of prostate cancer. And it's not something to take lightly. If you've noticed a sudden shift in your bathroom habits, it's time to book that health checkup ASAP. These first two symptoms might sound pretty common, but here's the key. Are you paying attention to what your body's trying to tell you? Stick with us, because coming up next, we'll uncover more critical warning signs, including one that flies under the radar, but could be a major red alert for this disease. Symptom number 3, blood in urine or semen. Have you ever spotted a little blood in your urine or semen, even just a faint pink or reddish tint? If so, don't ignore it. Sure, it might only be a small streak, but this is not something to brush off as no big deal. It could be tied to a urinary infection or kidney stones in some cases, but it's also a potential early warning sign of prostate cancer, especially in later stages. Here's why. As cancer cells grow, they can damage the tiny blood vessels around the prostate, leading to bleeding into your urine or semen. And here's the tricky part. It's usually painless, so a lot of guys let it slide without a second thought. If you notice anything like this, don't wait. Schedule a doctor's visit right away. When it comes to cancer, taking action early can literally be a lifesaver. Symptom number 4, pain in the pelvis, lower back or groin. Are you feeling nagging pain in your pelvis, lower back, or groin that just won't go away? And you're not sure why? If that sounds familiar, it's time to tune in to what your body's telling you. When prostate cancer starts to spread, it can affect nearby bones and nerves, triggering a dull ache or sharp pain in your back, hips, or pelvic area. At first, it might be mild or come and go, so you might think it's just a pulled muscle or too much time sitting at a desk. But if that discomfort sticks around for weeks, or even months, it's a signal to get checked out. Here's what's worrisome. A lot of men write this off as just aging or arthritis. But the reality is, if cancer has spread to the bones, treatment gets a lot tougher. So, if this is hitting home for you, don't hesitate. Talk to your doctor ASAP. Symptom number 5, pain during ejaculation or less semen. Have you ever felt pain or a burning sensation when you ejaculate? Or maybe you've noticed there's less semen than usual. If so, your prostate might be trying to send you a serious message. Normally, the prostate plays a starring role in producing semen. But when a tumor shows up, it can squeeze the tubes that carry semen, cutting down the amount or making ejaculation painful. It's easy to think this is just stress or a hormone shift, right? But if it keeps happening, don't take it lightly. It could be an early clue of prostate cancer. So, if anything feels off in that department, listen to your body and get expert advice from a healthcare pro sooner rather than later. These last 3 symptoms might not be as common, but when they show up, they could point to something serious. Don't sleep on them. Your health's too important. Coming up next, we've got more critical signs that way too many men overlook. And trust me, symptom number 8 is going to catch you off guard. It's got nothing obvious to do with the prostate, but it could be the most dangerous clue of all. Symptom number 6, erectile dysfunction ED. Have you noticed lately that it's harder to keep things going in the bedroom? Before you chalk it up to stress or just getting older. Hear this. It might not be all in your head. Erectile dysfunction can stem from a bunch of causes. But did you know your prostate plays a big role in your sexual health? When something's off with the prostate, it can mess with blood flow to the penis or pinch the nerves that help you get and stay hard. Red alert. If ED hits suddenly, especially alongside stuff like trouble peeing or pelvic pain, it could be a serious sign of prostate cancer. Don't shy away from talking to your doctor about this. Your health's worth more than any embarrassment. Symptom number 7, feeling like your bladder's never empty. Do you ever finish in the bathroom, but still feel like you've got to go? Maybe you're constantly thinking, didn't I just do this? If that's you, your prostate might be swelling up and pressing on your bladder, giving you that nagging urge to pee, even right after you've gone. Here's what's happening. An overgrown prostate can squeeze the urethra, making it tough to fully empty your bladder. That leaves you uncomfortable, running to the restroom more often, and still not feeling relieved. This can mess with your focus at work, disrupt your sleep, and just make life less enjoyable. If this feeling drags on, don't wait. Get it checked out pronto. Symptom number 8. Unexplained weight loss. Losing weight without trying sounds like a dream, right? But if you're dropping pounds without hitting the gym, changing your diet, or shaking up your routine, it's time to wake up. This could be a major red flag. In the later stages of prostate cancer, your metabolism can go haywire, causing rapid, uncontrolled weight loss. As cancer cells grow, they burn through your body's energy, stripping away muscle and fat for no clear reason. Heads up, if you've lost more than 10 pounds in a month or two without trying, don't ignore it. It could mean cancer's at work. So, if the scale's dropping out of nowhere, take charge and see a doctor to rule this out. Symptom number 9. Constant fatigue and loss of energy. Ever feel wiped out even after a full night's sleep? Like you're dragging through the day no matter what? This isn't just about being busy or stressed. It could be your body fighting something serious, like cancer. As prostate cancer grows, it can throw your immune system off balance and drain your energy reserves, leaving you exhausted for no obvious reason. Keynote: lingering fatigue isn't normal. If you're always tired, losing your appetite, or just not into your usual activities, don't brush it off as aging or a hectic schedule. Get to a doctor and get answers fast. Let's wrap this up. Don't sleep on any of these 9 symptoms. Sure, some of them might not seem like a big deal on their own, and they could be tied to other health issues. But when a few of these signs start teaming up, that's your body sounding the alarm, telling you it's time to get checked out. So, right now, take a quick second. Think about it. Are you noticing one or more of these symptoms? If the answer's yes, don't wait. Reach out to your doctor and get on top of it ASAP. The power of regular testing. Catch it early, protect your health. Now that we've covered the warning signs, let's talk about how to spot prostate cancer before it turns into a serious threat. The secret: routine checkups. Don't wait for obvious symptoms to show up. By then, it might be too late to act. Here's the good news. There are 2 key tests that can catch prostate cancer early, and they're both simple and straightforward. PSA test: quick, easy, and life-saving. One of the best tools out there is the PSA test, or prostate-specific antigen test. It's just a simple blood draw, painless, non-invasive, and packed with info about your prostate health. Here's how it works. PSA is a protein your prostate makes. If your PSA levels in your blood are higher than normal, it could point to inflammation, an enlarged prostate, or even cancer. To get the full picture, doctors often pair this test with other checks. So, who should get a PSA test? Guys over 50, make it a yearly habit. If prostate cancer runs in your family, start at 45. And if you're in a higher risk group, say, you're not super active or your diet's not the healthiest, don't wait. Get proactive and test early. It's a fast, easy step that could literally save your life. Why pass that up? Digital Rectal Exam (DRE). A few seconds that could save your life. Let's talk about another key test, the Digital Rectal Exam, or DRE. I know. This one makes a lot of guys squirm just thinking about it. But trust me, it's totally normal and incredibly important. Here's how it goes. Your doctor uses a gloved, lubricated finger to check the size, shape, and texture of your prostate through the rectum. Why does it matter? Sometimes prostate cancer doesn't bump up your PSA levels, but a doctor can still catch it by feeling for lumps or abnormalities. If they notice anything unusual, they'll follow up with more tests to nail down what's going on. Best part? The whole thing takes just a few seconds, but it could spot cancer before it turns dangerous. Here's the big takeaway. A lot of men shy away from this test because it feels awkward, but let's flip that mindset. One quick check could give you years of good health. Don't let a little discomfort stand in the way of your well-being. The bottom line, take charge of your health. Guys over 50, make prostate checkups a yearly routine. If prostate cancer runs in your family, start at 45. 2 simple, super effective tools. PSA test, just a quick blood draw, easy and fast. Digital Rectal Exam (DRE). A short check that can catch trouble early. Don't let hesitation or a wait-and-see attitude stop you from looking after yourself. If you've never had your prostate checked, pick up the phone and book that appointment today. Next up, we're diving into the most common treatment options out there. and how to manage side effects so you can keep living your best life. Diagnosis and treatment options. What's right for you? If your tests and exams raise any red flags for prostate cancer, the next step is getting a clear diagnosis and figuring out the best treatment plan for you. First things first, your doctor will determine the stage of the cancer. That's the key to tailoring the perfect approach just for you. Prostate cancer is typically broken into 4 stages. From early on, a small tumor that hasn't spread, to the later stages, where it's moved to other organs. So, what are the most common treatment options out there today? Let's break it down right now. 1. Prostate surgery, prostatectomy. A clean sweep. This is a go-to choice for guys in the early stages, when the cancer's still contained in the prostate. During surgery, the doctor removes the entire prostate, and sometimes a bit of surrounding tissue if needed, to make sure all those cancer cells are gone for good. It can be a total game changer, even curing the cancer completely. But heads up, there might be some side effects like erectile dysfunction or trouble controlling your bladder, especially in the first few months. The good news? With rehab exercises and physical therapy, most guys bounce back over time. Who's a good fit? Men under 75 in solid health. Cancer that hasn't spread beyond the prostate. 2. Radiation or chemotherapy. Targeting the cancer head-on. Radiation uses high-energy beams to zap cancer cells or shrink tumors, sometimes prepping them for surgery. Chemo brings in powerful drugs to knock out those rogue cells, and it's usually the pick when cancer's spread outside the prostate. What to watch for? Feeling wiped out for a while. Hair loss with chemo. Skin irritation where radiation's aimed. Tummy troubles or nausea. Who's a good fit? Folks who can't handle surgery due to health reasons. Patients with cancer that's already spread. 3. Hormone therapy, starving the cancer. Prostate cancer cells thrive on testosterone, so this therapy cuts that fuel supply by lowering your testosterone levels, slowing the tumor's growth. It's often used for later stages, or paired with radiation to boost results. Possible side effects: a lower sex drive, hot flashes or mood swings, bone thinning, which could up your risk of osteoporosis. Who's a good fit? Men with advanced prostate cancer. Those who can't do surgery or radiation. The key: managing side effects for a better quality of life. Every treatment comes with some side effects. But here's the deal. If you handle them right, you can still live life on your terms. Tips to ease the ride. Light exercise to keep your body strong and flexible. A healthy diet with prostate-friendly foods. Pelvic floor exercises or physical therapy to regain bladder and sexual function. Emotional support to keep your spirits up during treatment. Biggest takeaway: don't let fear stop you from finding the best treatment. Thanks to modern medicine, prostate cancer is totally manageable, especially when caught early. In a nutshell, there's a range of treatments based on your cancer stage and overall health. Each option has pros and cons, but you're not in this alone. Your doctors and care team have your back. Early detection equals better treatment outcomes and a higher quality of life. Next, we're tackling how to prevent prostate cancer with smart eating and a healthy lifestyle. Don't miss this, because it's your long-term key to staying strong. Diet and lifestyle, your key to preventing prostate cancer. We've covered treatments, but here's the real secret. The best way to fight prostate cancer is to stop it before it even starts. Research shows that a healthy diet and lifestyle can slash your risk big time, while boosting your overall wellness. So if you're ready to take control of your health today, let's dive into some simple, powerful changes you can make right now. 1. Cut back on red meat and processed foods. Are you a fan of juicy steaks, hot dogs, deli meats, or fast food? If so, it's time to pump the brakes. Studies link red meat and processed foods to inflammation and cell damage that can pave the way for cancer. What's the fix? Swap out red meats, beef, pork, lamb, for white meats like chicken or fish. Skip processed stuff like sausages, bacon, or pepperoni. Those nitrates in there can harm your cells. Love a good grill? Avoid the charred bits. They're loaded with cancer-causing compounds. 2. Load up on prostate-friendly foods. Instead of red meat, pile your plate with cancer-fighting powerhouses, especially ones packed with antioxidants and omega-3s. Green veggies: kale, broccoli, and spinach cut inflammation and deliver key vitamins. Tomatoes, packed with lycopene, a superstar antioxidant that can lower your prostate cancer risk. Flax seeds and walnuts, full of omega-3s to help stop cancer cells in their tracks. Fatty fish, salmon, sardines, mackerel fights inflammation and protects your cells. Green tea, loaded with polyphenol that slow cancer cell growth. Pro tip, kick off meals with greens, swap red meat for fish 2 to 3 times a week, and trade soda for green tea. Small swaps, big wins. 3. Move your body at least 30 minutes a day. Do you spend a lot of time sitting around? If so, it's time to get moving. A sedentary lifestyle can up your odds of obesity, hormone imbalances, and chronic inflammation, all tied to prostate cancer. How to get active? Brisk walking for 30 minutes a day. Easy and effective. Try swimming, biking, yoga, or hitting the gym to keep things flexible and fun. Desk job? Stand up and stretch every 30 to 60 minutes to break the sitting cycle. The bonus? Exercise doesn't just lower your cancer risk. It boosts your heart health, lifts your mood, and makes life better all around. 4. Keep your mind calm and stress in check. Did you know chronic stress can raise your cancer risk? When you're stressed out all the time, cortisol levels spike, throwing your immune system off and giving cancer cells a chance to grow. How to chill out? Meditate or breathe deep. Just 5 to 10 minutes a day to unwind. Sleep well. Skimping on shut-eye weakens your defenses. Aim for 7 to 8 hours a night. Hang out with loved ones. Social time boosts your mood and cuts stress. Do what you love. Read, listen to music, travel, or play sports. Whatever keeps you happy. Takeaway: a positive mindset doesn't just feel good. It helps your body fight disease better. The bottom line: start looking after yourself today. Tiny tweaks to your diet and lifestyle can slash your prostate cancer risk big time. Cut back on red meat and processed junk. Load up on greens, tomatoes, flax seeds, and fatty fish. Get moving for 30 minutes daily. Stay relaxed, sleep well, and ditch the stress. Don't wait for symptoms to care about your health. Take action now to protect yourself and the people you love. There you have it. We've walked through the 9 key symptoms that could signal prostate cancer, the game-changing power of early detection, and the proactive steps you can take to safeguard your health. So let's pause for a second and ask yourself, are you brushing off any of these signs? Way too many men let embarrassment or a wait-and-see attitude stop them from catching this early. But here's the truth: prostate cancer is beatable if you spot it in time. 3 big things to lock in. If any of these symptoms sound familiar from this video, don't wait. Get to a doctor now. Early diagnosis can be a lifesaver. One simple test today could dodge a major crisis tomorrow. Regular checkups are how you protect yourself and your loved ones. Schedule that prostate exam as your doctor recommends. My take: don't let ignorance or hesitation cost you your life. Taking care of your health isn't just about you. It's about showing up for the family and friends who count on you. Your next move: if this video hit home for you, hit that subscribe button right now and share it with your buddies and family to spread this vital info. Got questions? Drop them in the comments below. I'll do my best to answer every single one. Stay on top of your health, for yourself and the people who love you. Let's do this.